welcome to the Scotland Singing for Health podcast, produced by Scotland Singing for Health Network. I am Brianna Robertson-Kirkland, and today I'm joined by three very special guests. Before I introduce them, let me tell you a little about this podcast and why we're talking about singing for health. Singing for Health groups support the management of a range of conditions such as respiratory conditions, dementia, Parkinson's disease, and mental health concerns. In each episode of the podcast, we'll be talking to singers, singing group leaders, researchers, and medical practitioners to find out more about the benefits of singing and what Singing for Health activities are taking place all around Scotland. Today, our podcast focuses on singing for long COVID recovery, and we are joined by Pauline Waugh, who is a practice nurse who co-founded the Singing for Breathing charity, the Cheyne Gang, and who has been involved in setting up a new partner organisation, Long COVID Support Scotland. Dr. Keir Philip, who is a clinical research fellow at Imperial College London, who led on a research study on singing and long COVID during the pandemic. Keir is also a medical doctor specialising in respiratory and general adult medicine and has worked on hospital wards and intensive care with COVID-19 patients. And we have Gareth Williams, a Glasgow-based composer and songwriter who has been involved as composer-in-residence in Scottish Opera's Breath Cycle projects, working with individuals with cystic fibrosis in 2014, and more recently on a project for people suffering with long COVID symptoms. Thank you all so much for joining me today. So long COVID is something that we've all been mindful of over the course of the pandemic, and it's something that we may very well have impacted some of our listeners. But it's also a condition that perhaps we know not too much about. So I'm going to pass this over to Pauline. From your experience as a practice nurse and care as a doctor working in COVID wards, can you give us some insight into what long COVID is and how it might impact in people's lives?
So long COVID is also officially known as post-COVID-19 condition, which is a statement from the WHO, and they say that there's a history of COVID-19 infection with symptoms that continue for 3 months after the onset, a further 2 months, and there's no explanation other than that they are long COVID. And I think at the moment there's about 1.3 million people in the UK have long COVID, which is approximately 10% of all the COVID-19 cases that we know of. And we didn't test right at the very beginning, so there's bound to be many more cases that we don't know of. Pretty much is unclear. Keir might say something different about this, but we don't really know what the exact process is for the disease. It's fairly much a sort of inappropriate response, possibly of the autonomic nervous system. So that's our system, our nervous system that controls our involuntary body functions. Things like breathing, our heart rate, our blood pressure, our digestive system, all that kind of thing. And if it's not working properly, then it leads to the symptoms that we see in long COVID. So we see a lot of breathlessness, we see a lot of heart arrhythmias where the heart's beating irregularly, there's digestive issues, there's kidney problems, there's cognition issues, and I could go on. And we see all of these, or a mixture of these, in patients presenting with long COVID. There's a few other schools of thought. There might be persistent viremia, where there's an absence or a poor antibody response to the infection, and the infection is sort of remitting and relapsing. There may be some kind of abnormal inflammatory response, and the other thing I think that's been flagged up is a sort of post-traumatic stress disorder. What we do know is that the sort of symptoms that you get from long COVID don't correspond to your original COVID. So you might have had very mild COVID, possibly even almost asymptomatic, but you can end up with long COVID. You may have been hospitalised in intensive care, and there's obviously complications that go with that as well. But it doesn't mean that your long COVID is worse because you were in an ITU. It's very complex. It's sort of kind of multi-system and also quite a diverse disease. The variety of symptoms at the last count, I think, was more than 100, might be more than that. They're fairly much grouped into respiratory, cardiac, neurological, digestive, musculoskeletal, mental health, ENT, skin complaints, and possibly more. And the most common, and the ones that I've been seeing, are related to vocal issues, breathlessness, chronic fatigue, and brain fog. That kind of impacts mentally, physically, and socially on the patients that I see. Particularly, people are off work, they're struggling because they can't look after their children. It might be their children that actually have it, and they're having to stay off work to look after them. There's a lot of just unable to get back to your normal life, the life that you did have before. Huge amount of mental health issues with that. And it's just quite a horrible condition that we don't necessarily have a good way of responding to it yet across the country. Keir may have a different take on it and more information.
I think that's a very good summary, and I'd reiterate many of the points you've made there. I think there are lots of challenges around different sort of diagnostic criteria being used, which obviously changes our understanding of how prevalent it is or isn't. What we do know is that, as you've said, it is actually very common, depending on the sort of way that you define long COVID, or sort of prevalence estimates do vary quite substantially. But if you think, somewhere between, well, I think the most recent ONS data was suggesting over 3% of the UK population at the moment is suffering from some form of persistent symptoms after an acute COVID-19 infection, which, that's millions of people in the UK alone. So if you think globally, it's a massive public health issue now. As you've said, there's a few different definitions around, but this idea that probable or confirmed COVID preceding the symptoms is important. You don't have to have had a test. Many people won't have had tests, particularly in the beginning of the pandemic. The symptoms need to carry on for a while, but they don't necessarily have to persist from the initial infection. So some people may, as you said, had a mild initial infection, and actually these symptoms may occur later on down the line. Again, as you said, there's hundreds of symptoms. Breathlessness, fatigue, and cough are probably some of the most common ones, but all organ systems have been reported to be affected in some way, which does make things quite tricky in terms of how you manage it, and really requires approaches to treatment to be personalised. As you mentioned earlier, there's a few different sort of thoughts around potential underlying pathology sort of drivers of the problem, mostly focusing around things like the virus specific damage, so that we know that the virus itself can cause organ damage, which can persist. We can have immunological, so immune system abnormalities, inflammatory problems, either related to the initial infection or to sort of chronic infection, or possibly viral reservoirs that we do see in other types of viral infection, and lots of people have reported issues with blood clotting and as well. So, as you said, there's no specific test at the moment, so it's important that we do try and rule out other causes, because COVID has been everywhere and people have been getting other conditions as well during this period. But there's been such a focus on COVID that often symptoms might be attributed to COVID when they may have been from something else. So it's important that people are seen in clinical services to make sure there's not something else that might be driving some of the symptoms, and make sure they get appropriate treatment for that. Treatment wise, as you said, there's currently pretty much a lack of evidence-based interventions for this group of patients. Long COVID clinics exist and they're very useful, but most of the approaches will be sort of symptom-based and personalised, and trying to take a holistic approach to respond to the biopsychosocial impacts which Pauline described earlier. Although there's not much in terms of, very little in terms of evidence-based intervention specifically for this group at the moment, there are lots of trials going on at the moment. So we do hope that, in the future, we might have a sort of portfolio of treatments that can be, offered to individuals in a sort of personalised approach.
Wow, I mean, I heard a lot about long COVID. I know people who say that they've got long COVID, but to hear that this is really, it can be really varied depending on the person, and that it can really be varied in terms of systems and how it hits a person, So it could be that, someone is really struggling and not even realize that they maybe potentially have long COVID and should be seeking help if they think that something's kind of not going right. Is that a recommendation?
Certainly, I don't think we, as members of the public, and if we have symptoms, we should approach people who might be able to help us find out what might be causing them, and try to work with healthcare providers to figure out what the correct diagnosis is, which has been a problem as well. I mean, I think it's important to say from the beginning that accessing care for everyone for any condition over the last couple of years has been very difficult at times. And I think people with long COVID in particular have found it really tricky. Initially, there weren't services. Now there are services, but they're patchy. Even if there are, they can be quite tricky to get actually to access them, because you'll need a referral from a GP or similar. People who have been in hospital often end up getting into these types of clinics a bit more easily because they're already in the system. Whereas I know from speaking to quite a lot of people who had COVID in the community and then developed quite severe long COVID symptoms, that they found it quite challenging. I think that the initial lack of knowledge from the healthcare system as well has been a bit of an obstacle as well. And many people have felt that their symptoms have been, felt that they've been dismissed, because they have been dismissed on occasion. So I think, that's been a real challenge, and another cause of psychosocial stress for this group, who are already trying to deal with massive disruption to their lives. So I think, as we'll go on to talk about working with people who are affected in this way, I think, having a bit of understanding about the uniquely tricky position, is not doesn't capture it quite, but extremely difficult position that a lot of these people have found themselves in. They're trying to deal with a disease that people don't know about. People can't tell them how to fix it. They don't know how long it's going to last. It's a relapsing, remitting condition. Often you can feel like you're getting better, and then it can, come back in with force again. So it's a really, really difficult condition for these people, I think.
Indeed. And Keir, what has your research been looking at?
So my background originally, before I became a medical doctor, is I used to work as a dancer and had been doing various projects along the way using arts in health in different contexts. And I'd started off just before the pandemic, actually. I started to do a PhD looking at dance and singing for lung health, really, which I think most of the listeners will be aware of. It's a lot more established. I set up some studies, and then pandemic hit. So we converted one of the studies to online singing for lung health, with the results of which will be out soonish, I guess. Well, I hope. And then the other study, what we did is we say, look, we've got this this new group of patients. There's a theoretical basis for using singing for people with long COVID. So some of my old colleagues at Imperial College Healthcare Trust worked with the English National Opera in developing something called ENO Breathe, so the English National Opera's Breathe program. I think it was the first ideas came from the English National Opera, and they came to the staff at some of the team at Imperial College Healthcare Trust to make it a safe and useful intervention. So ENO Breathe had been developed, and it was being tentatively but positively rolled out. Had really good feedback. People were very positive about it, but you need to do a properly conducted study, really, to see if these things are beneficial, and also to make sure they're taken as seriously as possible by the established medical profession. So that's what we did. We conducted a randomized control trial comparing ENO Breathe to usual care. So randomized control trials where you randomly allocate people into one arm or another, so that you can then compare any changes you might see between the two groups. The ENO program is 6-week long, once weekly group sessions, and also has online resources that people can use throughout the program. And we assess people at baseline and then again after. And we found that the people who participated in the ENO Breathe program had larger improvements in the mental, but not the physical component of their health-related quality of life. They also reported some benefits to breathlessness. And what we did, as well as measuring these things quantitatively, is we also did a qualitative study as well. So it's called a mixed method study. And that was because we wanted to understand both if it had impacts and how it was having impacts. And because so little was known about long COVID at the moment, we thought the best people to tell us if it's having impacts and how would be the participants themselves. And they were very clear that, yes, they felt that it was the intervention was helping them with their symptoms. It was providing them with practical tools for breathing and for managing breathlessness. It was changing their emotional response to their breath and engaging with their breath. It was also providing a safe space to engage with the breath without focusing on the breath, which I'm sure many of you have heard as well with other people with respiratory conditions. They found that it integrated very well with the health service. And this was quite important. So we put it on the sort of back of long COVID clinics. So people had to have had proper assessment, been investigated fully, had management to the best of our ability, and then they would potentially, if at that point they were deemed potentially suitable, they could be included in the study, which was really important because with this kind of intervention, when you've got a group of people who are feeling quite dismissed and some people are feeling that people aren't taking them seriously, we found that it was quite important that they knew that they were, and that they definitely were being taken very much seriously, and that this was part of, but not instead of, other aspects of care. So overall, we found that it was a sort of a safe and beneficial intervention, which is fantastic. If anyone's interested, the paper was published in a journal called The Lancet Respiratory Medicine, and it's an open access paper, and I've tried to make it as accessible as possible. So have a read. My contact details are on there as well, so you can actually just email me if anything's not clear. But I've put in lots of the stuff of the qualitative things of the actual participants talking. So if you read that, it really does make a lot more sense in terms of what the impacts were.
That's excellent, and we'll link that paper in our show notes. So this type of work, it sounds very similar to the type of work that's been happening for a while in respiratory health conditions such as COPD, and using singing as a supportive mechanism. Is that right?
Yeah, there's similarities and differences. I'm sure Gareth has some good experience on this as well that he'd be able to talk. Because I know that you've been working in cystic fibrosis as well. So
yeah, well, yeah, I guess that was back in 2013 when it still felt kind of like a Philip K. Dick novel to be singing online and to kind of have to come up with a system where people who weren't allowed in the same room as each other, and we wanted them to sing. So it felt so revolutionary to be on Skype and to be doing these things and to be making ensemble things online. And then you you jump 8 years later and it's suddenly the most mundane thing. We are all simply having to be apart, and the only singing that can happen is online. So it did feel very prescient. The cystic fibrosis thing was had given us a chance to have a protocol and to have a sort of a methodology that would have been designed alongside Dr. Gordon McGregor at Garton Naval Hospital at that time, and Lisa Morrison, the physio. So we had something, but of course, also as Pauline pointed out, we were suddenly dealing with a group of people, and there was over 100 possible symptoms, and as Keir, as you said, it's unique and tricky, isn't it? So it doesn't matter what you think you're bringing to the table. It was soon obvious that we needed a new methodology and a new way to work with people who were kind of coming together under the banner of long COVID. So that was the little jump I made to get from cystic fibrosis to long COVID. When we did the pilot with people with cystic fibrosis, I was really keen to chase the data and to try and get some numbers and to try and get some stats. And we did hit some nice numbers, like, for example, like 14% increase in the FEV values and things like that. But we just needed more actual patients numbers. We needed more numbers to get a significant result like that. But this time I answered the bat signal from Scottish Opera from Gia Davidson to come back in and do this. And I thought, I just want to chase good songs this time. I want to chase some good singing. So I felt like this. So for now, we've been running for a year, and we've been singing and writing songs as opposed to trying to come up with a trial or anything like that.
And this project that you're referring to, Gareth, this is Scottish Opera's Breath Cycle 2, isn't it?
The sequel, yes. So I set that up too soon, but yes, we had Breath Cycle 1 back about 2013, 2014, and here we are returning with Breath Cycle 2.
And can you tell us a little bit about the initiative? So you've already mentioned a little bit about chasing the song, but what does it look like? What has your work been doing as part of Breath Cycle 2?
Yeah, let me hit the names of the team, because I often come away from these things and I realize I haven't credited my wonderful team, and then I kick myself for days. So we have 3 splendid vocal coaches, David Douglas, Jessica Ferguson, and Daniela Hathaway, and we're setting up weekly online singing lessons in blocks of 12 weeks. And the 3 vocal coaches are taking in turns to do quite gentle singing, some warm-ups, a lot of breath, a lot of kind of almost bordering on meditation, and then some big numbers, some actual singing together. So that's happening regularly. On the same week, a gorgeous writer called Martin O'Connor and I meet the gang almost in the vibe of a coffee morning, where we sort of set creative challenges and we chat and we write songs. And only one participant came to the first songwriting chat, which, obviously you do take very personally, don't you, as a songwriter. But we sat down and it was Sharon, and we had a conversation about what it was like living with long COVID during lockdown. And it sounded really ghastly, but Sharon wrote these words about doing the dishes. She said, "I can't do much. I won't do much. Things are piling up. They're piling up. Been on my own for so long. They're piling up. They're piling up. A simple thing becomes a scary thing, and things are building up. They're building up. Been on my own for so long. Things are piling up." And for a songwriter, which is what I am, I'm getting gold straight away as far as I'm concerned. This is what I want. I want to get an authentic story, and you want to find the right singer and the right song and put them together. So I was able to come back a week later and say, "Sharon, we've got your song. We've nailed your song together." So we worked on that for a while. And then we were able to share that, and more participants started to come into the songwriting sessions. And we have written songs about the voice, about singing, about doing the dishes, about being stuck inside, about the weather, just to pretty much any kind of prompt that come along, we'll tend to write songs about it. So I've gathered up, I think, almost an album's worth of songs now, working with this is over 3 12-week blocks. And Linda, for example, one of our participants said, that she says, "I never imagined that real life experiences could be turned into something so special as a song." But those are the best songs, as far as I'm concerned. And so I've had a real kick out of that. We started off thinking, when Jane asked me to come in to sort of develop a kind of methodology of working with people with long COVID, I thought, okay, why don't we do like a nice Monday night community choir vibe, 6 to 8, 6 to 9. You know what I mean? We can hang out online, we can do some singing. And I ran that past a focus group of people with long COVID. And they were like, absolutely, they were like, "You cannot do that. We do not have any energy after lunchtime. We do not want to do a 3-hour session." So we had to obviously immediately go, "Okay, good. Thank you for your feedback." And we've kept these as morning sessions. We've kept them a bit shorter. And so it's little baby steps that you make. As long as you communicate properly, it sort of stays within the realms of the possible.
So really having that contact with people who are suffering from these long COVID symptoms and finding out from them what they need is really important.
Yeah, I think, and it's been a very gentle curve to begin with. And I suppose the three symptoms that I've witnessed the most have been fatigue, breathlessness, and brain fog. And that's the three things that people have wrestled with the most. Um, and yeah, it's been incredible to witness over the last year. We are now recruiting to start again in October to run for another year now. And while that sort of focus is staying on long COVID, we're also welcoming other people who want to come in and join these sessions, our lovely vocal coaches, and these songwriting sessions to kind of keep going and build a little kind of artifact, I suppose, of our time.
Oh, excellent. And so what are people, I mean, you've already given us that lovely soundbite from one of the participants, but what are people on the whole getting from this type of project?
I mean, obviously we are doing very simple questionnaires just to get an idea of feedback and seeing if we want to tweak our methodology and having a conversation. I think that's so far as we've gone into gathering any data. So nothing as kind of as clinical and nothing Lancet worthy like Keir there. So, but maybe in the future. But I think we're getting a real sense of that that there's a return in energy coming from all activity based fun is the best fun, isn't it? And I think we're getting a real sense that there's some community building, that there's some sharing, some network getting built, and that there is an energy return on the singing and that sort of thing. Over in the songwriting sessions, we're getting even more a sense of community. We tend to run the session for an hour and then leave it on, and 45 minutes later, often the participants are still there having a conversation, sharing, swapping little ideas that they have, that things they've noticed have helped with symptoms and things like that. So, and then the songs themselves, I suppose I have to have that selfishness of a creative artist. I want good songs, and I want good, that's what it has to be for me. So I work with opera singers and pop singers and this group of singers, and for me it's all the same in terms of we're getting a really interesting experience.
Definitely. It sounds like a really interesting experience. So we can pop out, will there be details for people to be able to join that second breath cycle?
Yes. As I said, we're recruiting now for a second block, and that will run this year. We've been using social prescribing to attract some people to the course, so that's been a really nice way. Scottish Opera are now doing some recruitment and stuff. So please, if you fancy a nosy, give Scottish Opera Breath Cycle a nosy. And we have a few of the songs up online that you can listen to from the songbook that we're slowly building. And we should have a call out now for participants to get in touch to get a place. And that would be really nice. As I said, this songbook notion, I want this to grow and grow and to be this kind of nice little collection of songs. At the minute, I have to confess and I have to warn you that it's me singing them just as little demos, just to showcase the songs. That's not how they're going to exist in the future. I'm very keen to find other singers to sing them and for some of the participants to sing them themselves. But without that notion that it's like the X factor, in that it's all about that big push out onto the stage at the end of the process where now you're going to sing your show tune. What I wanted to, I think, say to the participants this time, that singing isn't about the moment you walk on stage. Singing is about this thing that you do every day that you fall in love with. It's about the practice of it. So I felt that was really integral to this time we did it this time around.
Excellent. And we'll link all of those resources, Scottish Opera's webpage and what's available. We'll link those in the show notes as well, so people can go and check it out. And Pauline, I mean, you've been doing some wonderful work with the Cheyne Gang already on respiratory conditions before long COVID, and now you've set up the Long COVID Support Scotland. Can you tell us a little bit about that work?
So we set up the Cheyne Gang back in 2013 and did our own little piece of research, very similar to what Keir's done, and looking at the physical, mental and social health benefits of singing for breathing. And we've been going for a long time now, and we're kind of well experienced in how to run these sessions. And Sophie is one of our voice coaches, excellent very excellent voice coach. And we realised that what we were doing with our groups was very similar to what we were finding with long COVID. So as a practice nurse, I was seeing patients with long COVID who were presenting with breathlessness, particularly fatigue and issues with their voice as well. And we chatted about it within the team and said, look, we probably can help people with long COVID in the same way that we help people with COPD and bronchiectasis and chronic bronchitis and chronic asthma as well, and kind of put our heads together. And what we find is that people with long COVID and people with COPD have a very similar dysfunctional breathing pattern, which has come from, in long COVID's condition, it's because they've had a respiratory infection and their body has tried to control that respiratory infection. So it changes the way that they breathe. And most healthy people, when that's happened to them, they've had a chest infection, their breathing pattern goes back to normal. But in long COVID, it doesn't seem to do that for everyone. And we see that a lot in COPD and people with long-term respiratory conditions, where because they have physical damage to their lungs over a long period of time, the new way they breathe becomes very habitual. And it's kind of the same in long COVID. And that is to use all the upper respiratory muscles, and they're all tense and you see them like this, and they're using these big strap muscles. And what we teach is to lower all of that and to breathe from their belly, and to open their voice box and to use their abdominal muscles to support their breath and to breathe through their nose. You can tend to find that they breathe through their mouth and then they overbreathe. So all of these things, if we teach what we call, I'll have to read this because I always forget it, it's nose, low, slow. So that's breathing through the nose, putting your breath right down into your belly and using your belly muscles to support your breath, and then breathing more slowly. It takes a long time to learn it, particularly with people with long COVID, because of their exhaustion and their fatigue. It does take a long time to get them to work in that way. But what we've seen so far with some of our voice coaches who've worked with some patients with long COVID on a one-to-one basis has been really, really, really good. So we took our expertise in that field, and then we explored what was happening in Scotland. And as Keir was saying, in England, you're very lucky. You have long COVID assessment clinics. We don't have those in Scotland. So in Scotland, if you've got suspected long COVID, then you present with your symptoms. So let's say it's breathlessness. You go to your GP with breathlessness, you get referred to respiratory. But if you've got breathlessness and a heart issue and musculoskeletal pain, you have to go to 3 or 4 different departments to see all these different people in separate hospitals. There is no one-stop shop in Scotland. In some parts of Scotland, there are a few, but there's not any. It's not across Scotland, so the care is very varied for long COVID across Scotland. And that's a bit sad because the Scottish Government are not putting money into that. They're putting money into research, which is excellent, but there's a bit of a gap between research and us that are trying to provide care on the ground. So we discussed the other types of symptoms that people with long COVID have. We discussed it with people, some of our primary and secondary care colleagues who are working with them. So things like speech and language therapy. We looked at occupational therapy. We looked at obviously respiratory physio. And we managed to gather together a little team who really were wanting to help us to create a support. So it's going to be Long COVID Support Scotland, and it's a website where people with long COVID can go and see little videos, just little snapshots of their symptoms to help with their symptoms, whether it's to do with their voice, whether it's to do with swallowing, whether it's to do with fatigue. They can go and just have a relaxation session. They can go and do a little bit of yoga. They can do a little bit of Pilates. They can have a speech and language therapist explain how to control their cough. And they can work their way around all those videos, or they can just go to the specific video that's relevant to their symptom. And of course, there's singing in there, which is the very important part of it. We do have one of our coaches who does a song, and again, just teaches about dysfunctional breathing and how to begin to do your nose, low, slow breathing, and also just fun. As Gareth was saying, it's a lot about fun and joy. And within the Cheyne Gang, when our patients and our members report back to us about the singing sessions, it's about joy. It's about social connections, and it's about all having the same condition and how they get together. And they don't really talk about their condition. They talk about their families and they talk about what's going on in their life. And they come away, and Sophie will tell you that they're smiling, they're happy, even if it's just for that wee part of their day. But, then they come back the next time and the next time and the next time, which is fantastic. So we hope that when people go to our long COVID site, they will have that same joy as well, and hopefully they will get some benefit from it. I'm sure they will get some benefit from it.
Absolutely. And it sounds like from each one of these projects that's happening, which are similar but also different, that getting that sense of fun, that joy, is a really important part of the whole process, and that in turn is helping people feel a little bit more energized.
It's worth just mentioning that one of the particular things about long COVID that affects lots of people is something called a post-exertional symptom exacerbation. So it basically means once they've, if they've exerted themselves physically, mentally, or emotionally, or through any means, some people do have this particular feature of their condition, which means that they can have a bit of a crash. They can get really quite unwell from it. They can become very, very fatigued. So I think that all of these things are obviously brilliant for the right people, but we do need to just be careful to warn people that they need to listen to their bodies and sort of maintain that dialogue, and like Gareth said, get that feedback, and shape what people are advised to do accordingly, just so we make sure that we are not doing any harm. That's it.
Well, it's funny, and I think I think that's a really good point. Like, do no harm is a really good starting point with all these projects, and we can be so. I know I can be so enthusiastic and so sure that it's the right way forward. But as I said to my songwriters in the class one day, I was like, if songwriting is so great, why am I stressed all the time? Because I write songs every day, and it is all about context and safeguarding. And one of the things we do is always make sure that there's a couple of staff from Scottish Opera who are just there witnessing the session, making sure everyone is okay behind the scenes, and just doing that little bit of kind of looking after everyone and making sure no one goes too far. Because, we did notice, I mean, it did feel like some people would simply send a message saying, no, not today. I don't have it in me today. And we have to be very much at peace with that. Or I'm here, but I'm not going to participate. I'm just going to take a back seat, and they're very welcome too. So yeah, it's all about balance. That can be harder to achieve online, can't it? Because you can't always read a room. So you just have to make sure you've got something safeguarding there to make sure everyone is okay.
I think, as well, highlighting to people that they need to sort of listen to themselves. Most people are good at doing this anyway. Although there's lots of different ways in which people are affected, people often start to have quite a good understanding of how they personally are affected, and therefore what they can and can't do. So it's just creating that safe space in which people feel happy to engage in that way, to the extent that they want to. And it's very much it's not a condition to push.
So what's really coming out of this is that it's a new condition. There's a lot of research going into it, but we still don't know an awful lot about it. And so the important advice and the important message is, if you feel that you can, then try, but otherwise listen to yourself, listen to your body, and seek appropriate medical attention if you're struggling and needing help.
Always, for sure. I think I made that point about not wanting anyone to feel like at the end of our 12 weeks they're going to be pushed out on stage to perform to their friends and family. I mean, it's not that kind of thing. It's not that sense where there would be any escalation or anything. It's about practice and about finding your level with these things.
Absolutely. And Pauline, just getting back to the Long COVID Support Scotland. So we've got these videos that people could engage with and interact with. If people are wanting or searching for other types of resources, or perhaps a singing group, where might they go? Is there advice on the Long COVID Support Scotland website?
Yeah, and with all the videos that we've created, they're all professionals who've made these videos. And as Keir was saying, we're very cautious as health professionals. We understand the risks, and we have disclaimers, and we have videos there that explain you only do what you can manage to do. And we've always done that with our patients with COPD as well, because they're the same. They can't always manage to stand up to do the session or do the full session. So with each person who's created a video, they've also given us support sites that we can signpost people to as well. I have been tempted to say to people, just go and join a choir, but I don't think that's necessarily the right thing to do with long COVID. I think you need that professional input. It's great to join a choir, and I'm obviously in one, and I love it. But there are some days when I feel knackered and I really can't do the full session, just as somebody who's had COVID, and took a little bit of time to go back to my activities. So I think if you're going to do the singing for breathing, you should really try and find a group that does have a professional involved, or has somebody like Sophie, for example, who's had the correct training to deal with singing for breathing, because it's not just singing. It is singing in a specific way, or rather it's kind of, we call it by stealth. So you get taught the breathing exercise and then you put them in to effect through singing, and you really don't necessarily know that you're doing them, but you really are. And the feedback that we've had in various forms, quantitative and qualitative, has been really positive. But I wouldn't recommend that you do that without having the training behind you. So there are definitely resources, but I think you have to look for the correct ones and not just recommend something without knowing how well that's set up and how well that's managed as well.
That's true. That's a conversation we started recently, and I think when you want your project to have a legacy, that you do want at the end of 12 weeks or 24 weeks, you do want to say, continue this journey, keep singing. But yeah, you're right. That has to be safeguarded too, and that's tricky. But luckily, I think there's a little network of kind of safe spaces starting to emerge now, and practitioners who are able to kind of bring something that fits.
Yeah.
And you might find as well, the trajectory of people's experience with long COVID can be very different. So although some people take a few months to get better, many do get better. Equally, many are even a couple of years now still very disabled by long COVID. So you might find that some people have actually got back to normal for them, and at which point maybe a normal choir would be suitable. It's just getting that really sort of personalized understanding of where someone is and where they've been and where they're going as much as possible, to understand what's appropriate for them at that particular point in time. But I think, continuing on into a choir for people who that's important for, it sounds like a great idea. But it's definitely not going to be for everyone. There's certainly some people who, what may seem as a low intensity activity to some people can be extremely challenging for them. I don't know if any of you have seen it. We did a study about last year. It was looking at the physiological demands of singing for lung health. So, when people go through the different components of a singing for lung health program, what different activities they do, whether it's vocal fricatives or repertoire or whatever, and looked at how much oxygen they were using, how much carbon dioxide they were producing, what happened to their heart rate, what their lung volumes were doing. And we compared it basically to walking on a treadmill at different speeds, and found that it was in healthy volunteers, but we did find that actually the components of singing for lung health are quite physiologically demanding, sort of quite comparable to walking at a sort of moderate pace. I think this is actually is something which we do kind of know as well. So anyone who's engaged in community singing groups for a while, you go to you have a proper sing, and at the end of it, you're tired. You're physically tired. You've engaged in some moderately intense physical activity. So we just have to, I think, when we're thinking about the situation of long COVID, there are going to be many people who that's not going to be appropriate for.
Yeah, absolutely. So that's why it's really important for you to listen to yourself, which is kind of the advice that's coming loud and clear from all of you here. And what we've been doing at Scotland Singing for Health Network is we have been curating a map of all the Singing for Health groups that are available in Scotland. That map is now available to view on Scotland's Singing for Health website, and we will provide the link to the map in the show notes below. And there are some singing for long COVID support groups that are coming forward now with trained practitioners who have gone through Singing for Health, Singing for Respiratory training. But in the meantime, all of the resources that we have discussed here today, we will link in our show notes, including the Long COVID Support Scotland website as well. So just as we're wrapping up our podcast episode this evening, I wondered if any of you had anything that you would like to add before we close the show.
I actually thought you were going to say, does anybody want to sing? And I'm so glad that you didn't say that.
I've got my piano. I mean, I could I?
Give us a song, Gareth.
No, it's really nice to stick my head up and meet some other people who are immersed in this world and in terms of long COVID. And I think you do tend to get in your silo and you concentrate on your project and the participants involve your attention and you really want, long COVID becomes about this little group of faces on a screen. And then you take a step back and meet and see that there's a lot of other stuff going on. So I find that really inspiring, and I know it's going to be helpful as before we just undertake another year of this now. So thanks for having us.
I just think I'd say, keep talking to everyone who's involved in this and share information, and that's going to be the best way to develop something which is really useful for people is talking to people who have got experience, talking to people who have got experience both as providers but also as people with long COVID who are participating in these kind of activities. And it's through that discussion and collaboration that I think we can move forward to something that's really useful.
Yeah, absolutely. And Keir, do you have plans for future research projects going forward?
We have got a few things. I mean, so as I mentioned, we've got one study that's going round the co-authors that was just looking at the effectiveness of online singing for lung health for COPD. But more long COVID specific, we've got we're looking at we're just looking in more detail really to try and understand who is most suitable for this program and what it is that they gain from it. So it was interesting actually to hear what Pauline said earlier about breathing pattern as one of the main focuses, if you like, or potential treatable aspects of their breathlessness. So, as we spoke about at the beginning, the reason that people have symptoms, or the reasons people have symptoms, are quite complex, and they could have lots of different sort of driving pathologies. But thinking about the bits of the experience of breathlessness and the symptom of breathlessness that are treatable, breathing pattern is definitely a big part of that. And then also, the emotional engagement with being breathless and the experience of using your breath in one way or another. And I also would actually go back to what Gareth was saying about really focusing on the art of it and the expression of it, not focusing on the breathing at all. So although we've done quite a lot of talking about breathing, it almost shouldn't, I don't know, I'm not going to tell people who actually run these sessions how to do it, but the feedback that we've had is that, having a focus which is just nothing to, it's completely on the enjoyment, the creativity, the engagement. That's where the focus should lie if it can, and that's where the most benefit can happen.
Absolutely. And through a lot of our podcast episodes, that's been the clear message that's come out, is that the aim of most people running these groups is that they want people to have fun. And a lot of the people who are part of the groups, the reason why they go is because they're having fun. And it's not really about how they sound. It's more about the enjoyment of singing and the social engagement of being as part of a group doing it. Thank you all so much for joining me today. It's been absolutely fascinating hearing about long COVID, hearing about all of your fabulous projects. And I'm just going to close the episode by saying thank you all for coming along and giving up your day to speak with us all. Thank you all for joining us today. Next week, we're joined by Matthew Brown and Roseanne Gross from Scottish Opera. and they'll be talking to us about the Memory Spinners project. Thanks for listening. This podcast is produced by Scotland's Singing for Health Network, a project hosted at the Royal Conservatoire of Scotland, funded by the Royal Society of Edinburgh, and in partnership with the University of Edinburgh. For more information on our activities, please visit our website. Details are in the show notes.